Diaphragmatic breathing.
First, position the patient in a relaxed semi-fowler position. The therapist then will place their hands on the rectus abdominis just below the anterior costal margin. Ask the patient to inhale slowly through their nose, keeping their shoulders and upper chest quiet, allowing the abdomen to rise slightly. The patient should exhale slowly through their mouth, letting their abdomen return to neutral. This can be progressed to self-monitoring by the patient. The patient will place his or her hands on the abdomen and watch it rise and fall to ensure proper technique.
Segmental breathing, lateral basal expansion.
The patient will begin in a hook-lying position and later progress to sitting. The therapist will place his or her hands on the lateral aspect of the patient's lower ribs to direct the patient to the areas where the movement should occur. The therapist should ask the patient to exhale, and then the therapist should feel the rib cage move downward and inward while applying pressure into the ribs with the palm of their hands. Just prior to the patient's inspiration, the therapist should apply a quick downward inward stretch. This maneuver can also be performed independently by the patient. The patient can apply resistance with their hands, towel, or a belt. Posterior basal expansion. The therapist will have the patient in a sitting position with their hips slightly bent forward, leaning over a pillow to relax. The therapist then will place his or her hands over the posterior aspect of the lower ribs. Then the therapist should ask the patient to exhale, and the therapist should feel the rib cage move downward and inward while applying pressure into the ribs with the palm of their hands. Just prior to the patient's inspiration, apply a quick downward inward stretch.
Pursed lip breathing. The patient should be positioned so that they are relaxed. The therapist should then ask the patient to inhale slowly and deeply through lightly pursed lips. The therapist should describe the exhalation as blowing on and bending the flame of a candle, but not blowing it out. Postural drainage.
The therapist should cup both hands by keeping their fingers together and their thumb in. The therapist should then strike the patient's chest wall in an alternating rhythmic manner. The therapist should try to keep shoulders, elbows, and wrists loose and mobile during maneuver. This procedure should not be painful or uncomfortable for the patient.
Right and left upper lobes. Anterior apical segments.
The patient should be in a reclined sitting position. Percussion is applied directly under the clavicle.
Posterior apical segments.
The patient should be in a sitting position with their hips slightly bent forward, leaning over a pillow to relax. Percussion is applied above the scapulae The therapist's fingers should be curved over the top of the shoulders.
Anterior segments.
The patient lies supine with a pillow under the knees and head. Percussion is applied bilaterally, directly over the nipple or just above the breast.
Right posterior segment.
The patient lies flat in 1/4 turn from prone on the left side. Percussion is applied directly over the right scapula.
Left posterior segment.
The patient lies 1/4 turn from prone and rests on the right side. Head and shoulders are elevated between 30 to 45 degrees. Percussion is applied directly over the left scapula.
Left lingula.
The patient lies 1/4 turn from supine on the right side, supported with pillows, and between a 15 to 30 degrees head down position. Percussion is applied just under the left breast.
Right middle lobe.
The patient lies 1/4 turn from supine on the left side, supported with pillows behind the back, and between a 15 to 30 degree head down position. Percussion is applied under the right breast.
Right and left lower lobes. Anterior segments.
The patient lies supine, pillows under knees, between a 30 to 40 degree head down position. Percussion is applied bilaterally over the lower portion of the ribs.
Posterior segments.
Patient lies prone with a pillow under the abdomen between a 30 to 45 degree head down position. Percussion is applied bilaterally over the lower portion of the ribs.
Left lateral segment.
The patient lies on the right side between a 30 to 45 degree head down position. Percussion is applied over the lower lateral aspect of the left rib cage.
Right lateral segment.
The patient lies on the left side between a 30 to 45 degree head down position. Percussion is applied over the lower lateral aspect of the right rib cage.
Superior segments.
The patient lies prone with a pillow under the abdomen to flatten the back. Percussion is applied bilaterally directly below the scapulae. Although not shown in this video, postural drainage techniques should be followed by vibration and an effective cough.
Mucus. Colors, types, and meanings. Hemoptysis. Expectoration of bloody sputum. Amount may range from blood streaked to massive hemorrhage. Purulent. Pus, yellow or greenish sputum, often copious and thick, common with acute and chronic infection. Mucoid, white or clear, not generally associated with bronchopulmonary infection, but present with chronic cough. Frothy, white or pink tinged, foamy thin sputum associated with pulmonary edema. Mucopurulent, mixture of mucoid, sputum, and pus, yellow to pale green, associated with infection. Rusty, descriptive of the color of sputum, classic for pneumococcal pneumonia, also called prune juice.
Get that mucus out. Time for chest percussion. Patients upside down. Time for chest percussion. Postural drainage congestion sure ain't pretty. Like his cough and sounding.